A controversial long-term care bill in Ontario just passed in the provincial legislature. That bill allows for hospital patients waiting for a long-term care bed to be sent to a home that is not of their choosing. And already critics are responding with anger. Here's some of what we're hearing at a news conference this hour.
We need the healthcare leadership to wake up to how cruel and ageist that decision is. This is not normal. Ontario is an extreme. And yes, it's other options to long-term care, respectfully, yes. But also, we have fewer hospital beds than anywhere else. We run our hospitals at rates of overcrowding that no one else in the world, civilized countries in the world do not do. They don't have this kind of terrible cruelty to access resources for people who are aging and dying that we have. And it's a failure of health planning. So I just feel really strongly like there has to be a way to cut through the fact that this has become normalized to the point that a provincial government thinks that they can pass a law that is almost a death sentence for one particular group of people. It's hideous, and it needs to be shown for that.
CBC's Megan Fitzpatrick is on the story live from the provincial legislature in Toronto. So cruel, ageist. Megan, what else are you hearing?
So the reason that news conference was happening, Suhanna, is that 3 groups have written to the Ontario Human Rights Commissioner asking her to launch a formal investigation. This is not the first time they've done that. They also did that in 2021, and they are renewing that call in light of Bill 7 because they argue it is a further example of discrimination against Ontario's elderly people, and that it violates their human rights and it violates other laws like the right to informed consent, privacy rights, and that is because Bill 7, I'll just explain a bit more about what it actually does. This is to do with patients who are in hospitals and have been designated what's called ALC, alternate level of care, meaning they don't really need to be in the hospital anymore, but they are on waiting lists for a bed in a long-term care home of their preference. And what the Ford government is now doing is trying to basically fast track the movement of these patients into a long-term care home somewhere, not necessarily the home of their choice. And they're going to allow for hospitals and placement coordinators to do all of the legwork essentially without a patient's consent to get them admitted to a home. Now, that may not be of their choosing, and it's not clear how far away it might be from their home and their community and their loved ones. So these groups are arguing that this is further discrimination against a targeted group of Ontarians, and they're calling on the Ontario Human Rights Commissioner to do something about it. Here's a bit more of what they said at the news conference.
We at the Advocacy Centre for the Elderly are hearing the voices of many, many, many Ontarians who are crying out for new initiatives to provide better and more in-home and community-based services. We all need to listen to these voices, and we need to provide alternatives so that admission to long-term care is always a free and voluntary choice, not one made under coercion for lack of any other alternative.
So they're calling for more to be done so that elderly Ontarians can stay in their homes if they want to, that they don't have to go to a long-term care, and other community supports. Again, as you heard in the clip, saying that they should not be coerced into going into a long-term care home if that's not where they want to be. Now, this request to the Ontario Human Rights Commission could very well be rejected, Suhanna. This might not go anywhere, but I can tell you that the opposition groups here at Queen's Park are also reacting to passage of Bill 7, vowing to keep fighting against it, and they are fully expecting to hear stories from their constituents once this law starts being put into place in practice.
And how is the Ontario government defending this legislation, Megan?
Well, they say there's a need for it and that it's the right thing to do. Part of the rationale for it is to clear space in hospitals. The Ford government saying these acute care beds are needed by other patients. And they're also explaining this legislation by saying, these elderly patients, if they have been discharged by a doctor, that a better place for them is in a long-term care bed, not in a hospital bed, that they'll get better quality of life in a long-term care home. But these groups, these critics were just saying, you know, if there is room in a long-term care home, that's probably for a reason, that these might be the least desirable beds. And they talked about, you know, the experiences that the COVID-19 pandemic laid bare for residents of long-term care homes. But nonetheless, the Ford government is forging ahead with this. They did fast-track the bill. It was introduced less than 2 weeks ago. The Ford government skipped the committee hearings. That's usually a chance for the public and stakeholders to weigh in. That didn't happen with this bill. It was sped up and passed very quickly, again, because the government says there's an urgent need for it. There's still some unanswered questions about it, though, Sue-Hannah, including how far away a bed might be found for someone, and also if they refuse to move, if they refuse to take that bed that's being offered to them, what would happen? Will they be charged fees by the hospitals? Here's a bit of what Premier Doug Ford said about that when he was asked in question period.
It's not about the cost. It's about giving proper health care to people that should be in long-term care homes. It's differentiating between sticking your loved one in a hospital bed. Imagine that, a hospital bed, or one of your loved ones when the alarms are going off, bells are going off all night, compared to giving them a beautiful home to stay in, a long-term care home, which will have proper care.
And the long-term care minister, Paul Calandra, also defending it in question period as well. Now what's next is awaiting those guidelines that will go along with this piece of legislation that has now been passed.
We'll talk again. That's CBC's Megan Fitzpatrick in Toronto.